Basic MRI protocol for knee. For routine knee imaging, the imaging is done in all three orthogonal planes, namely axial, coronal, and sagittal. In a routine sequence, the proton density images are taken in sagittal plane. This is basically for the delineation of the anatomy. Then, proton density fat suppressed images were taken in all three orthogonal planes. This is the most important sequence as it is a fluid sensitive or edema sensitive sequence for the demonstration of pathology. Additional T1 coronal images were taken, and this is the best for demonstration of the fascial lines. The most important imaging sequence is the PD fat suppressed images, and this is done with a parameter of there is time of repetition is between 3000 to 4000 milliseconds. Time to echo is between 40 to 50 milliseconds. That is kept a little higher than the usual PD sequences. The matrix is kept between 256 into 192 or above. The field of view is usually kept small, between 14 to 16 centimeter. The thickness in all planes are between 3 to 4 millimeter. The axial images are taken from lower part of the quadriceps tendon, covering the attachment in the lower part, covering the attachment of the patellar tendon into the tibial tuberosity. The coronal plane images are taken parallel to the femoral condyles, and the sagittal images are perpendicular to the coronal plane. The knee is kept at 5 to 10 degrees external rotation so that the sagittal image plane can be parallel to the anterior cruciate ligament. This is better for demonstrating pathology of the anterior cruciate ligament, as well as the ligament can be seen in one images. Apart from these routine sequences, one can add 3D cartilage sensitive sequences, GRE sequences, post contrast, there is post gadolinium T1 fat set sequences according to the clinical indication. Sometimes an MR arthrogram is asked for. This is nothing but interarticular injection of the gadolinium, and after that imaging in all three orthogonal planes with T1 fat suppressed images.